gonna shine my light on you. Ready? Here we go.
One of the things that drew me to the Washington University School of Medicine is this environment that encourages you to discover what you're most passionate about as a clinician, and then is able to provide the mentorship, the organizational structure, and the resources to help translate that vision into reality.
Say ah.
One of the things that's so important as a physician is to be able to treat patients from all life experiences. To be in an environment that empowers you to empathize, sympathize, and humanize our patients is a gift.
My clinical training has been wonderful. I have had the opportunity to really hone my skills in my patient interactions. The attendings with each clinic are very supportive, so they're always pulling more information out of you, testing your knowledge, and also challenging you to think more broadly.
One of the really fantastic things about being a trainee here is just everything you get to see, the intensity of the services provided, and the autonomy that the trainees are allowed.
Pretty much from day one, you're getting into the operating room, you're getting to the clinic and seeing patients. So this program has really taught us independence, while at the same time having a huge faculty department behind you. So we have a really big catchment area. Anything complicated from the surrounding states gets sent here.
We are a large hospital, which can seem very overwhelming at first, but you realize that we are large in geographic size, we have lots of patient beds, but we are a community, and we interact with each other, not in a hierarchical structure that you might see at other institutions, but we are working as a team.
I don't know how WashU manages to pick people that work well together, but they've been doing that consistently because, across the classes you can see that they really gel well together. Before all of COVID started, we did a lot of social things. One of the things that we've done is, in a smaller group, we went to an ice cream place. We were able to still appropriately socially distance and still get to meet people. I feel like I'm forming incredible lifelong memories and lifelong friends.
I have been impressed at the work-life balance that they have here. There's time for exercise, there's time for building personal relationships. They do a lot to make sure that we're getting enough time in the hospital to really prepare us. However, that they recognize that to really be at your best, you need to have time for yourself and bring that energy that you get from that back into your work. One of the things that I really like about St. Louis is you have the city, and then 10 minutes later you're out in parks.
So definitely one of the reasons why I chose to stay for residency was because I fell in love with St. Louis. I think my favorite part of the city is Forest Park. There's bike paths, running paths, a free zoo. There's an art museum that's on top of this beautiful hill.
Having been here now for about 6 years, it was one of the best decisions that we ever made. When you combine kind of how accessible things are, how affordable they are, it's really worked for us.
As we were going through medical school, we always heard our professors give their life story that they had come for training, left, and then bounced back.
Except we would always look at each other and say, it's not going to be us.
And
but
as it turned out, that was exactly what happened, and it's for good reason. You have to realize the cost of living in St. Louis is a lot lower than in cities where a lot of our peer institutions are located, and it makes a difference as you're going through your training to be able to enjoy your life a little bit more.
What we found is that the doors were always open here, and that wasn't always the case other places, and we were thrilled to get back here.
Our faculty and students come from all different backgrounds. There's more than one way to get here, and I think that diversity really plays out in the type of care and training that we're able to provide. There's not only one way to be a doctor. You have to discover your way of getting where you want to go, and we want to make that possible for people.